Good morning. We are very honored to have Dr. Wennberg here this morning in this interview. He's director of the Renal, Pancreas and Heart Transplantation Unit at the Karolinska University Hospital at Stockholm, Sweden.
True.
Starting with the interview, I would like to start with a personal question. Maybe it's if you can tell us why did you decide to become a surgeon and specifically a surgeon involved in transplantation?
Well, I think it mostly is a coincidence, in fact. It was not a planned decision, unfortunately, but I was sort of headhunted during the course in surgery during my medical education. I was asked if I could not sort of help out at the Department of Transplantation during the summer, so that was the start of it. So then I have stayed.
From then on?
Yes.
Oh, that's very interesting. So, given your experience, you know that transplantation it's a multidisciplinary field where professionals have to be trained. Do you think that we are facing a crisis of specialists involved in transplantation process?
Yes, well, I don't think there's a crisis, but I think we have a problem because it's quite difficult nowadays to attract young doctors to have an interest in transplantation, and that's the problem for the future. I would say it's not a crisis today, but it could become a problem for the future.
We talk a lot about indicators in our network, and as in your experience, do you think that the current indicators we are using in transplantations are the right ones, or do you think that we should focus them on another field?
Well, I think they are quite good when it comes to the medical outcomes, because we know how to measure that. I would say we have to have more interest in the patient's views, I think. So to look at their view of their care, their experiences, the quality of life, and that type of things. And I think also one important thing, and that is connected to your first question, I think, with attracting young investigators to this field. I think we also have to have indicators that measures and specifies the healthcare providers and the competent authorities side of this issue, because they also have to step up and do a good work in this field. That is one important thing to attract young investigators, I think. They must feel that they are supported by sort of a good and thorough interest from the healthcare providers.
Very interesting. And do you think that you mentioned indicators at healthcare provider level and national level? Do you think that the current level of collaboration between the different transplantation programs in one center and other hospitals it's good enough, or we should also focus on that issue?
Of course we should do it, and I think this European Reference Network is one very good initiative in that area, because we need to, especially when it comes to these rare disorders and rare patients, collaborate much better. I think that's very important.
Yes, I agree with you. And in this case, what do you think TransplantChild can help to improve in this field, especially in the ones about indicators and collaboration about the hospitals all around Europe?
I think the TransplantChild will have a very, very important task to fill in the future, because I think this is the key. This is the right level to collaborate when it comes to rare disorders and rare treatments. We have to collaborate on the European level, because the national level is not sufficient.
Perfect. That's very interesting. Well, we hope that we have practically started working in TransplantChild, and we hope that we will keep doing it together.
I think so. I hope so.
Thank you very much.
Thank you very much.
Thank you.